Time now for Restoring the Soul of Healthcare from the Help Care Clinic in Austin.
Yes, on a Thursday, always a pleasure to visit with Dr. David Strobel and Lee Acey from the Help Care Clinic here in Austin. Gentlemen, good morning.
Good morning, John. Glad to be with you. Good morning.
Good to hear from you, as always. And kind of continuing on a theme we've been on for a couple of weeks now, continuing talking about services provided, and today specifically point-of-care testing at the Help Care Clinic.
Yeah, as we have discussed previously, we have more than 55 of the diagnostic blood tests and urine tests, I guess, that are sent out to LabCorp, which is our reference lab facility, and that's a really good economical way for us to be able to provide that information that Dr. Strobel and Stephanie Kimmis, our nurse practitioner, need to inform care. But there are also some kinds of testing that are called point of care that we're able to do right on site here through the lab, through our nurses and through the lab. And so wanted to have Dr. Strobel talk about these tests and how they fit into the overall plan of being able to provide good care to patients and our members.
Yes. So the point of care testing are tests that are basically waived from some of the regulatory requirements that a regular laboratory needs in order to perform lab tests, and that's a legal requirement in order to ensure that quality is maintained. But there are a number of these that are very simple devices and simple testing that is pretty straightforward and doesn't require a lot of additional work and high-level laboratory training to be able to maintain them as accurate and correct. So we're hoping to be able to add a couple of additional ones, but right now we are in a position to be able to test a few simple things, and these are things that people are familiar with. For example, being able to test for a strep throat, being able to do a urine test to evaluate if somebody has urinary symptoms, if they might have an infection, for example. We can test for hemoglobin level, which is the red stuff in your blood that carries carbon dioxide and oxygen, and so that kind of can rule out anemia, for example, and glucose levels or blood sugar levels with a finger stick test. Urine pregnancy testing is another thing that we'll be doing. We have the ability to test for blood that might be in the stool. We've got some of that testing. We will be having the COVID-19 test available, and then also we'll have INR testing, or what we call prothrombin time testing, or PT testing. This is for people that are on warfarin or Coumadin. That's a brand name. And folks take that in order to decrease the chance of clotting of blood in some different circumstances. And so the INR test is necessary in order to monitor for people that are on Coumadin or warfarin long term. And so that's a test that we have available. And we actually have a very good device for testing that. And then hopefully before too long, we will be able to do testing for mononucleosis, or mono, and also for respiratory syncytial virus, which is RSV. So that's going to be part of the panels that we'll have available as well.
When we talk about these particular tests, these are some of the, this is kind of your average guy asking this, are these some of the more common tests? And because of the frequency of it, it's worthwhile to have the equipment and the lab abilities to do these tests. And some of the other ones are just a little bit more rare in that it's really not efficient to have all the equipment there. It would be better off to use a laboratory outside.
Right, and They're not necessarily rare because we do them very commonly, the other tests, but there are different tests that are waived from the regulations, and the other tests require more regulatory environment and requirements. And so the tests that it's the CLIA organizations, the Clinical Laboratory Regulatory Agency, and so some tests are CLIA waived, and some of them require CLIA certification. And CLIA certification really increases the complexity of maintaining a lab, and so then that raises the cost significantly because of need for additional trained staff and protocols and all kinds of things like that. And so small clinics don't usually do CLIA certified lab tests. They basically collect specimens for them, and then they send them to labs that are CLIA certified, like LabCorp, or we'll send them sometimes to Mayo Clinic Health System here in Austin, or some people might want to go to Mercy One in Mason City, or over in Albert Lea, or they might go to Olmsted Medical Center. So these are larger labs that are CLIA certified labs, and so that kind of thing is needs that regulatory environment. The point of care labs are things that aren't CLIA certified, so they're CLIA waived because they've got very good accuracy, even without needing to do all of the regulatory environment or regulatory requirements that are necessary. But they're things that you might want to know about pretty quickly, and so that makes it easily able to do it. And there are some other ones that we could add in as well.
Well,
I'd say, just one thing I'd add in there that kind of in that trade-off is that one, for instance, that Dr. Strobel suggested that we don't do is the lipid panel. That there is a CLIA waived, version for that, but that's actually maybe even a little bit more expensive than the send out to LabCorp testing that we do, and it's also not something that you need to know immediately. The lipid panel isn't like a strep infection or something like that you want to get treating right away.
Well, and I was going to say, it kind of strikes at the core of what you're trying to do is make it most efficient and economical for people to really have a good handle on their health care and have that accessibility. And at the same time, if you need to go to these other tests and do something more, you have total access to that. It just might be a little bit more of a fee compared to the base of the testing that you have included in your membership.
Right. And there's a delay when we send out lab tests. I was seeing somebody just a bit ago that needs several lab tests done. But she also, I'm wondering if there might be a urinary tract infection. So we're doing a urinalysis in the clinic, but we're also collecting blood specimens that we're going to send out, and it'll be a few days before I get those results.
Okay. Well, fair enough. And like you said, you're always looking at the wins and ifs if you'll be able to add more testing and just make it much more thorough there as you're able to.
Right. And there's for most primary physicians, there's basically one lab test that we all wish was CLIA waived that we could do, and that would be the complete blood count, which looks at the white blood cell count and the different kinds of white blood cells. And the only thing we can do that's part of that test here is the hemoglobin. And that's a test that often is very helpful to get the result quickly in many cases, but it's a CLIA certified test, and so that means that in order to do that test quickly, you have to have a certified lab. So that's where the bigger organizations, can provide that kind of service, and we just simply won't be able to do that. But that's the same in all small clinics. It's not different for any of the others.
Yeah, and I would assume as a doctor too that would almost be a frustration of yours, that you want to be able to do everything you can, but of course there are rules and regulations and procedures, and you certainly go by all of those as well.
Yes, and I don't want to I don't want to do away with that regulatory environment. I mean, the regulations are there for quality measures. But it's also true that some of these tests used to be done in small doctors' offices, and there wasn't such regulation. But the reason the regulation occurred is because there were some quality issues at times. And so then we've lost the ability to do some of those tests more rapidly, so they need to be sent out or they need to be done in a place nearby that can do them quickly. But that's just the trade-off that you have, and it's the regulatory environment that we all work in.
And before we run completely out of time, Lee, it's kind of the point, is that the majority of what you really need are included in the membership, and at the same time, when you have the membership, you still have access to anything that you would need should you need it.
Right. I mean, there's something like 3,000 potential tests in the catalog that we can get done through LabCorp, and we've said that there's 57 of them that we've done so far that have been included in the membership. We haven't had to charge for an external test so far, but we do have that full menu available as needed. But having these on-site tests that can be able to provide that rapid feedback can be important, particularly in these conditions where you want to start treating something right away.
Absolutely. And we are kind of counting down the days now as we're going through the month of July, about a month and a half of the early sign-up for the membership to get the discount. We should remind people about that.
Right. Between now and August 31st, people can save $20 a month on single, couple, or family membership. And so that's available. They can come stop by and see us at 308 4th Avenue Northwest, which is just a block east of St. Augustine's. They can give us a call at 507-279-2345, or if they go to helpcare.health, HELP care.health, there's information there as well, and we'd be glad to talk with folks about the whole scope of services that we're able to provide through this model.
Yeah, I would encourage people to get as much information as you can and look into the Healthcare Clinic. Check out their website, helpcare.health. All the different topics that we talk about are posted there. And, of course, you've got a section on frequently asked questions and probably answer most of the questions people have right there.
Very good. Yeah, we hope so. But again, we're very personable and inviting. We hope to have people stop by and see for themselves what this is like, because we think it's a pretty welcoming, inviting, and friendly experience for people with healthcare.
Absolutely. Gentlemen, have a fantastic week, and we look forward to visiting with you again next Thursday.
Yes, indeed.
Appreciate it, John. Thanks.
Right.
Okay. Thank you.
Bye-bye. That's the Healthcare Clinic here in Austin, our weekly get-together. Again, check out their website, helpcare.health. Got all the information there for you, or stop by, say hi, and learn more about the Healthcare Clinic.